You sit in the doctor's office, the paper gown crinkling beneath you, and watch as the nurse wraps the Velcro cuff around your arm. You feel it tighten, squeezing harder and harder until your pulse throbs against the fabric. Then, the hiss of releasing air, silence, and the look on the nurse's face that tells you everything before she even says the number. 160/100. You are in the danger zone. You are a walking time bomb for a stroke, a heart attack, or kidney failure. The doctor walks in with a prescription pad, ready to put you on a lifetime of beta blockers, ACE inhibitors, or diuretics, pills that might keep you alive but will leave you feeling tired, dizzy, and battling a dry cough or brain fog for the rest of your years. It feels like a prison sentence. But what if that high pressure isn't a permanent state? What if the stiffness in your arteries could be relaxed not by a synthetic chemical synthesized in a lab, but by a deep red elixir that has been used for centuries in cultures that rarely suffer from the heart disease epidemics we see in the West? What if you could drink a single cup of a specific tea and watch your systolic number drop by 10 to 20 points within the hour? This is not folklore, this is biochemistry. There are natural compounds that mimic the exact mechanism of blood pressure medication without the side effects, working to flood your system with nitric oxide and relax the tension in your blood vessels. Today, we are going to bypass the pharmacy and go straight to nature's most potent vasodilators, hibiscus tea and beetroot juice. We will explore how these ruby red drinks can unlock your stiff arteries and bring your blood pressure back down to a safe, healthy range. To understand why your blood pressure is high, imagine holding a garden hose. If the water is flowing normally, everything is fine. But if you squeeze the hose, the pressure builds up behind your thumb. The water sprays out violently. This is what is happening in your body. As we age, our arteries lose their elasticity. They become stiff and rigid due to calcification and inflammation. At the same time, the endothelial lining, the inner skin of your blood vessels, stops producing enough of a critical gas called nitric oxide. Nitric oxide is the signal that tells your arteries to relax and widen. When you don't have enough of it, your vessels stay constricted, and your heart has to pump with tremendous force just to circulate your blood. This constant pounding damages the organs, the eyes, and the brain. The solution, therefore, is to reintroduce elasticity and boost nitric oxide production. The star of this show is a flower that is likely growing in gardens all over the world, but whose dried calyxes hold a medicinal power that rivals the drug captopril. We are talking about Hibiscus sabdurifa, commonly known as sour tea or carcade. When you brew the dried petals of the hibiscus flower, you get a deep, crimson tea with a tart, cranberry-like flavor. That red color comes from anthocyanins, powerful antioxidants that scrub the arteries of rust and damage. But the real magic lies in how hibiscus acts as a natural ACE inhibitor. In your body, there is an enzyme called angiotensin-converting enzyme, or ACE. Its job is to constrict blood vessels and raise blood pressure. Pharmaceutical drugs like lisinopril work by blocking this enzyme. Studies published in the Journal of Ethnopharmacology have shown that hibiscus tea does the exact same thing. It inhibits the ACE enzyme, allowing the blood vessels to relax and open up. In clinical trials, patients who drank 2 to 3 cups of strong hibiscus tea daily saw their blood pressure drop just as significantly as those taking standard medication, but without the electrolyte imbalances or fatigue. However, you cannot just drink the sugary, bottled hibiscus iced tea you find at the gas station and expect results. The sugar creates inflammation which hardens the arteries, completely canceling out the benefits of the tea. To use this as medicine, you must buy the dried hibiscus flowers. They are very cheap and available at most health food stores or online. Boil water and steep 2 tablespoons of the dried flowers for at least 5 to 10 minutes. The longer it steeps, the more medicinal compounds are extracted. You want it tart. That tartness is the organic acids working. If you need to sweeten it, use a small amount of stevia or monk fruit, but never sugar. For an acute hypertensive episode, where you are feeling the pressure rise, drinking a warm cup of this tea can start to show a lowering effect in as little as 30 to 45 minutes as the compounds enter your bloodstream and begin to disable the constricting enzymes. While hibiscus works on the enzymes, our second powerhouse works on the gas. Beetroot juice is perhaps the most reliable biological method to instantly boost nitric oxide. Beets are rich in dietary nitrates. When you drink beet juice, these nitrates interact with the bacteria in your mouth, yes, in your mouth, and are converted into nitrite. When you swallow that nitrite, your stomach acid converts it into nitric oxide, which is absorbed into the bloodstream. This gas travels to the smooth muscle cells surrounding your arteries and forces them to let go. The effect is almost mechanical in its reliability. A study from Queen Mary University of London found that drinking just 1 cup of beetroot juice lowered blood pressure by an average of 10 points within a few hours, with the effect lasting up to 24 hours. This is a massive reduction, enough to take someone out of the stroke zone and into safety. There is a very specific catch with beetroot juice that almost everyone misses. Remember how I said the bacteria in your mouth are responsible for the first step of the conversion? If you use antibacterial mouthwash, you kill those bacteria. Studies have actually shown that using antiseptic mouthwash can raise your blood pressure because it destroys the microbiome needed to process nitrates. So, if you are using beets as medicine, do not use mouthwash. Furthermore, cooking beets reduces the nitrate content significantly because nitrates are water-soluble and leak out into the boiling water. To get the therapeutic effect, you need to juice raw beets. A mixture of beetroot, carrot, and a little apple to cut the earthy taste is a potent heart tonic. If you don't have a juicer, you can buy high-quality beetroot powder and mix it with water, but fresh is always superior. Combining these two strategies creates a synergistic effect. You can start your morning with a glass of beetroot juice to flood your system with nitric oxide, opening the hose for the day. Then, in the afternoon and evening, sip on hibiscus tea to keep the AC enzyme inhibited and maintain that relaxation. This provides 24-hour coverage for your vascular system. But there is a third element that supports both of these, and that is the balance of electrolytes, specifically potassium and magnesium. High blood pressure is often driven by sodium sensitivity, too much salt holding on to too much water. Potassium is the antidote to sodium. It tells the kidneys to flush out the excess salt and water, lowering the volume of blood the heart has to pump. Hibiscus and beets are naturally high in potassium, but you should also be looking at foods like avocados and leafy greens to support the effect. You might be wondering if this is safe to do if you are already on medication. This is where you must be careful and consult your doctor. Because these natural remedies work so well, if you combine them with a full dose of blood pressure medication, you could drive your pressure too low, leading to hypotension, dizziness, and fainting. This is not a sign that the tea is dangerous, it is a sign that it is working. Many people find that after incorporating hibiscus and beets into their routine for a few weeks, their doctor is able to lower their dosage of medication because the body is beginning to regulate itself naturally. You should monitor your blood pressure at home daily so you can see the trend and make informed decisions with your healthcare provider. It is also important to address the lifestyle factors that spike pressure in the first place. Stress is a massive trigger. When you are stressed, your body dumps cortisol and adrenaline into the blood, which clamp down on the arteries. The ritual of drinking tea itself can be a countermeasure to this. Taking 10 minutes to sit quietly, breathe deeply, and sip your hibiscus tea adds a meditative, stress-reducing component to the biochemical benefit. Deep breathing alone has been shown to lower blood pressure by activating the parasympathetic nervous system, the rest and digest mode. Some people worry about the kidney stone risk with beets because they are high in oxalates. If you are prone to oxalate kidney stones, you may want to lean more heavily on the hibiscus tea in moderation with the beets, or ensure you are drinking plenty of water and getting enough calcium, which binds to oxalates in the gut and prevents them from crystallizing in the kidneys. For the vast majority of people, however, the cardiovascular protection far outweighs the risk. The feeling of high blood pressure is often described as a tightness, a buzzing, or an anxiety that you cannot shake. It is your body screaming for flow. It is your heart asking for help. By ignoring it, you are gambling with your life. But by answering that call with the deep red nutrients found in hibiscus and beets, you are giving your body exactly what it needs to heal. You are providing the molecular keys to unlock the stiff doors of your arteries. Imagine going to your next doctor's appointment, watching the nurse wrap the cuff around your arm, and seeing the surprise on her face when she reads, 120/80. Imagine the freedom of knowing that you are not dependent solely on a pill bottle, but that you have the power to control your own physiology with the food and drink you consume. It is possible. It starts with the kettle, the juicer, and the decision to take your health back into your own hands. Drink the red tea, flush your arteries, and let the pressure go.